Is it anxiety or is it akathisia? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent. And one of the related topics that comes up about this is that of akathisia. So, akathisia is an intense internal sense of restlessness that most often, but not exclusively, occurs as a result of a psychiatric medication, usually an antipsychotic, but it can also occur as a result of antidepressants, benzodiazepines, and not just taking these things, but also withdrawal from them as well. But it can be hard to distinguish for both the patient and the clinician whether or not when they report anxiety, it's due to akathisia or anxiety. And it's important that we tease out this difference because if it's anxiety, you may assume that they need a higher dosage of medication, which can actually result in worsening akathisia. So here are 5 questions that I recommend asking to determine if someone has akathisia or if it's anxiety. So first, I'm going to ask, does anything provoke it? If it's anxiety, there's often some external situational trigger. With akathisia, it's unprovoked. It can come out of nowhere. 2, I'm going to ask, have there been any recent medication changes? If it's akathisia, it's more likely to occur if there's been a recent medication change, either a new medication added or a dosage increased. As compared to if someone has been on the same medication regimen for a long time, it's less likely, but not impossible, for akathisia to appear at that point. Third, I'm going to ask, is the anxiety in your body or is it in your mind? With akathisia, it's not usually accompanied by a fear-based thought like it would be if it's anxiety. Whereas if it's anxiety, you're going to be ruminating, having racing anxious thoughts that may also have physical symptoms. The akathisia is just going to be those physical symptoms. Number 4, can you control it? With anxiety, typically the restlessness and antsiness that accompanies it can be suppressed by the individual. With akathisia, it's really hard to suppress those movements. And even if you can suppress them for a little while, they're probably just going to come out even bigger than they would have otherwise. And lastly, I'm going to ask, does anything make it better? So if it's anxiety, maybe they would say, oh, deep breathing or taking my as needed medication or talking to someone. Whereas with akathisia, the only thing that's going to make it a little better, if at all, is if they are moving their body. So they may say, oh yeah, if I pace back and forth, or if I exercise or go on a long walk, my anxiety gets better. Of course, there are a lot of other questions you can ask to differentiate between the two, but here are 5 that can be really helpful in cases where it's not so clear. If you have any questions about this or other questions that you think would be helpful to ask in these situations, then please put them in the comments below. Additionally, if you're interested in getting more direct resources from me, I do have an email list going and I send out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.